Hi, folks. Hi, welcome to Because Looking Good Feels Good with me, Dr. Janet Allenby. Today, welcome to my house. We are still in stay at home to be safe for everybody. And we have a very special guest, Allie and I. So, again, welcome to our house. So, today we have a doctor who is so cool that he is known by a single name, and that is Shino. So Dr. Shino Bay Aguilera will be joining us, and we're going to talk about something that's really important to both of us who are cosmetic dermatologists, that a lot of patients are very fearful of looking weird or looking strange. They all want to be natural. So he will be joining us in just a second. And, I think that's one of the biggest things that I see in my world is people will come in more so than cost keeps them from wanting to do things. It's they're afraid they're going to look weird. And that's certainly a huge issue. So we will be talking about that. And let me tell you a little bit about Shino. He will be joining us in a few seconds. Let me just check on this because I think I'm not so great at this. Anyway, so I'm kind of new to the Instagram world, so you guys got to bear with me because I don't know how to do half this stuff. And thank God for my staff who's working tirelessly while we're in this shutdown to kind of help me keep in contact, because I am going cuckoo without you guys. I will tell you, I miss you guys severely. And, it is actually kind of interesting. I'm going to just share a couple things real quick before Shino comes on. One of the things that, I think of the first week is just like, oh my gosh, I don't have connection to people. I'm like really craving that because it's, being single by myself here with Allie. And I guess Shino's joining us right now, so we're going to bring him in. But just being I think for the first, week, I was just like, wow. I'm sad about seeing everybody. Hi, Tina.
Hi,
Thank you
Con.
for
How
joining
are
us.
you? Good.
So much for
Can,
being here with
can
us.
you hear me okay?
Oh, you look like you just got up out of bed.
Yeah, well, that's every day for me.
Oh, you got the life right there.
Yeah, just get up and come out, look at the ocean and trying to be positive. That's all I can do.
And you know what? Actually, I was just talking about that. I was saying, the first week home, slowing down, I kind of was like really sad to be away from everybody. But I think kind of that you get recentered. You recenter yourself, and you kind of are like, wow. You kind of start thinking of things that are important to you. It's not always about work. It's not always about how much stuff I can have. It's more about what are the things that are important to me, especially when you see so many people suffering and so people doing just heroic things out there to help each other. It's such a wonderful thing to see the community coming together for them.
Yeah, I feel like it is sad to see how many lives being lost and seeing all colleagues being on the front lines and working so hard to save lives. But all this time that I have to think for myself, it's just like we needed a reset. Everybody, the whole world needed a reset. Nature needed a reset. Our economy needed a reset, and I needed a reset, and you needed a reset because there's so many things that I think that I want to do in life, but I just got
You get caught up.
something.
Yeah.
Yeah, I just feel like I just jumped into this train of success and it's work, and I never have time to think about what I'm doing with my life or what I want to do with my
Right.
life.
And we got to just take our success to different things that we enjoy and that are meaningful to us. I will tell you, I love your section on spirituality, and I I'm so grateful to know how much, that means to you. I know you're a dreamer, and you're a brave co-dreamer, because people, if they ever get to talk to you one-on-one, they know, the upbringing you had, the life you had, and what you've made of yourself is remarkable. It's a beautiful thing for you to have gotten to where you're at today. And I think we all applaud you. And I think it shows every day in your work, because the beautiful outcomes that you give people, it's all there.
Thank you. Well, I think the same thing about you. I look up to you.
Wow. Definitely in this, because I love you here. So,
No, I
anyway,
really do.
so let me introduce, and I don't know anybody who doesn't know Shino. And when I told my staff I asked you to join us, they're like, Shino! So Shino is one of those few people that has celebrity status that can be recognized by one name. But Dr. Shino, please never forget that he does tremendous work, and he does work tirelessly This fellow is on the road probably half the year and practicing the other half of the year. So, like you said, maybe we'll kind of revamp on life and what we want to spend time with. But it is a matter of, you really have done your due diligence, you've done your work. Nobody can ever say, wow, this guy, isn't like on top of his game. You're one of those few really famous people, especially in Instagram, in the social media world, that I can say, I am actually the person who's doing the work and I'm famous with it, which is kind of unusual out there.
Yeah, no, nothing comes success overnight. You know that, including like us trying to get into medical school, all those sacrifices. Then being in medical school, which was a big sacrifice. Then the internship was the year that you really wanna kill yourself because it's just the hardest year of your life. Then you try to get into dermatology, which is almost nearly impossible for so many people out there. Then you get in, and then again everything starts, and then you get out of it, and then you have to work for somebody, but you dream to be solo, and you get to be solo, and then the first 2 years of being solo, you really want to drive your car into a canal because it's just so great. So people don't understand that it's a lot of sacrifices, a lot of years of hard work. So you have to be almost insane to want to do this.
Yeah, well, yeah, it's good insanity, I think. At the end of the day, it gives us both, I think, a lot of joy. So that's like the real reason to keep striving. As otherwise, you and I would be doing something totally different. I know both of us.
Yeah, and then at the end you realize that it is a calling. It's not, for me, it is a calling because I love what I do, and if I had to do it all over again, I would do it because I think we are not doing life-saving procedures, but we're doing life-changing procedures, and it's equally as important.
I think so. And I don't want people to think that we're just being light because we're talking aesthetics here. Because, that's the title of the series is because looking good feels good. And if how your spirit is just as important as everything else in your life. It's as important as your economic health, your physical health, and your mental attitude towards yourself and the self love. I think is paramount, and that's what we help people with. And honestly, they help us with it for us too. They give back as much as we're giving to them, which is the great part.
Exactly. Exactly. It's like whenever you are in the room with someone, there's an exchange of energy. So you're giving some energy. And remember, we're in the world of vanity, which is the world of fear. So spiritually, I feel like we have this huge responsibility as healers or light workers because we take that fear away so people can go on their life feeling positive, looking up to the future, not being so to throw the towel because you are a certain age. But look at you, look at me. I'm on my 50, I'll be 52. I have 8 years of enjoying great life, but I'm looking forward my 60s. At 40s, I was looking forward my 50 because 50 doesn't look so bad anymore. And I don't need to behave certain way because I'm 50. As long as you take care of yourself physically and emotionally, doesn't matter what decade you are, you can do the best you can with your life. So we adding life to their years instead of years to their life. And that's an important responsibility.
I've never heard anybody say it exactly like that, and I think that's beautiful. And you know what? Again, you are beautiful inside and outside. And that's actually kind of what is so good about our profession is that I know you have an eye for beauty internally, but you definitely have a very great eye for beauty externally, and that's where you really come and help people. When they come in our office, we help them psychologically, emotionally. You know what? You have really good outcomes too, physically, and that's what gives them that extra boost and that extra confidence. And I know you have a huge, huge fan base out there because every time I ever say your name, oh, we're gonna go do. Like, wow, Shino, so you're an amazing person, and we applaud you all for that. Just so everybody knows, you practice in Fort Lauderdale, and you have Shino Bay Cosmetic. You're one of the founders, Shino Bay Cosmetic Dermatology and Laser Institute. You do, I think, a lot of people know you're filling, but you've been a laser expert for years. For those who don't know, you are somebody who's on the podium lecture a lot, you lecture to doctors, you lecture to patients. So you are really out there and you've given it all your all. And, that's why we're having you, because I want people to really hear real life doctors that really are doing the work and actually understand where people want to go and how they get there. So for a couple questions, we kind of talked, what would people be interested in hearing? And I think, one of the big things is we in our world do non-surgical. Obviously, we're doing our fillers, we're doing our threads, we're doing our devices, whether it's laser or whatever. How do you decide? A patient comes in, maybe they don't want to go to surgery, but they're kind of like, I'm not talking young ones, because we all know you could just fill them probably and they look fine. But somebody who might be like teetering on to going surgery, how do you keep them from going there if they can not go there? How do you make those
Well,
decisions?
I will have a conversation because not everything is surgery. And I know back in the day when I was a child, I know that the only thing that they had was surgery, which is two-dimensional, right? You pull, you tug, and it's two-dimensional. But now, with the help of fillers introduced into our industry, it forced us to actually learn anatomy a lot better. I remember when I started doing fillers, I was like a cowboy. I would put it here, put it there, but I wasn't afraid. Now the more I know, the more afraid I am, because now I know what is underneath. They're blind procedures. We don't have X-ray vision. So everything we do are blind procedures because we need to know anatomy. And on top of that, we really needed to understand the aging process. So we know that aging is three-dimensional. So I have that conversation with my patients about the fat loss, bone remodeling. And you could pull and tug the skin and tighten the muscle. But if you lose the three-dimensional architecture of the bone or the fat that cannot be replaced by pulling and tugging, even those patients that are contemplating to get surgery, they need to work on that three-dimensional architecture before they pull. Otherwise, they look like they just jump out of an airplane on a parachute, right?
No, everything I do, I think you and I are definitely always on the same page anyway. And it is one of the big conversations that I have is like, you do still recognize when an older person has a facelift, they still look like they had a facelift and they're older. I mean, they look better because they don't have wrinkles, but you can still identify the age because of the structure. And we've gone from filling lines to actually restructuring faces, heads, the whole thing.
Yeah.
So become new architects, or it's a whole different ball out there. So when a person comes in, they said, Shino, I just want you to fill my nasal labials. I would love these guys, no matter what I do. So if you could help me with that.
You look beautiful, so you don't need anything.
So, I mean, what do you say to somebody who wants to, fill for the mirror is what I call it, versus fill for the effect that we have? And I know you and I understand that it's you walk in a room and how people perceive you is ultimately the goal, even if you don't know it, consciously. That's our subconscious wow moment.
Correct. And the way I learned about how to deal with that issues when I started doing Sculptra, which actually you are the pioneers in Sculptra. Like I said, I look up to you. I remember being a resident, you were out, and I know you are a big Sculptra user, and you've been using for a long. You've done so great things for that brand even before I came out. But Sculptra really uh, changed my life because at that moment I was only a laser expert, and then when I embraced Sculptra, which I was a Sculptra hater because all I thought was bad things, but it forced me to learn a lot about bone loss, bone remodeling. So it was when I thought, how am I going to convince a patient that you need to do something that's going to take 2 months to see the results, and you may need another session to actually get you happy. And then I realized that we have to educate our patients about the future. We want to have a relationship, not for now, but for years to come, for decades to come. So the way I were able to succeed on having somebody to do Sculptra was teaching them about the aging process. What happens at 40? What happened at 50? What happened at 60? By doing that, the patient realized that yes, this is a symptom, but you need to fix the cause. And if you go for the rapid fix, eventually you're gonna be happy, but you're gonna age prematurely
Yeah.
if you don't fix the cause.
Right. And when you do fix the wrong spot, that's when you get the weird beard look. And I think people have to really understand we're doing this for their best interests. And we look at it as a long-term relationship where I think some of them think, oh, they want to do all this stuff on me because they really don't understand the architecture. And you're like, no, I just want to help you at the end of the day, look better. You know, I have 6 people waiting for me in the other room that I can go run to, you know, so please believe me when I'm telling you these conversations that we are having right now.
Yeah, you know what helped me? It was I actually created a video. It was about 7 minutes long, and the video it was me talking in front of the on the video, and then behind me there were photos of what those fat loss looks at 40, what those fat loss looks at 50, and bone loss. So before the patient got to see me on the consultation, they were asked to watch the video, and that really changed my life. Actually, I went from doing 50% closure at consultation to 90% closure, because most patients don't know that part of aging is bone loss, bone remodeling. And if you have a patient that really cares about their appearance and they just learn from you that one of the reasons why they will look elderly is because they have bone loss on their face, they're gonna go, what? And they're gonna do whatever they can to preserve it. So that video helped me because, one, I didn't have to repeat myself all day long. 2, it has graphics for the patient to understand what this looked like. And 3, by the time I got into the room, the patient was educated and they all wanted to know, all they wanted to know is what can you do for not having to lose this architecture.
That's why you're one of the front factors, you know, one of the forerunners. You're always thinking ahead. I like how innovative you are, and you know, like just you try to make it simple for people to understand. And you know, it was easy for you being foreign born, coming here. You know, language is always a barrier, so it can be frustrating, I'm sure. You know, but I think that you have learned how to make things simpler, and I think that's, you know, keep it simple, as they say, is always the best. So, other questions that I know people always ask, and you know, like there are a lot of fillers, and you and I are huge sculpture people, and for those who know both of us, they know that. What other fillers, and actually, even if you want to talk about sculpture, because it is one of my loves, you know, what are you seeing as far as, are there changes with fillers? You know, how do you decide on which filler to use for people? And I agree. I think it's structure that's most important. Do you start more outer face and work your way in, or you know, the old way where we kind of sit here? Like, what do you do?
Yeah, it all depends. So if I'm gonna do fillers like HAs or radius, I definitely like to work from lateral, because studies have shown that if you work lateral first, you have more lifting capacity. So I divide my selection of fillers according to gender, race, even the color of the hair makes a difference, and also the age of the patient. So also I divide it in rejuvenation, which are your older patients, they already have bone loss, bone remodeling. Prejuvenation, which are your patients that are starting to see changes, but they still don't look elderly. And then beautification, which is enhancement, just for the young patients, the millennials. They don't need anything, but they may be not so lucky in terms of getting great cheekbones or a great jawline, or maybe the chin is not very strong. So, but the best way to choose a filler is learning the rheological properties of the filler itself, according to what you wanna choose. So, for
Maybe
example,
make it simpler for the people listening. They don't know what rheologic properties mean.
okay, so rheological property is this physical properties that each filler has according to the way they're made. You know, they all look like this clear gel on a syringe, but they behave different in vivo and in vitro according to these physical properties that they have. So we talk about G prime, which is the stiffness or elasticity of the product. We talk about viscosity, and viscosity is how well the filler behave with shearing forces, like if it has friction. And that's important that when you put the filler here, you want it to stay there. You don't want it to spread, right? The spreadability of the product. And then you have cohesivity, how well the filler want to stay together. If the filler breaks apart or is made in a way that breaks apart easily. And then you have the new rheological property introduced by Galderma, which is with the expression technology, how well the product stretches with movement, right? So these are the different rheological properties that I look at when I'm going to select a filler.
Yeah, and I think people don't really realize we do have a lot more choices. We're not like Europe where we have a gazillion choices, but we learn each product separately and find its characteristics that work best in our hands, and I consider them tools. And I think that you hit it on the head. It's a matter of certain things need certain products, and it's because of the properties, like you're talking about, of each filler, which are unique. And when somebody is a little more limited on how much they can do, to try to prioritize what are we going to fix first, because one filler they may say, oh yeah, I wanted my cheek to put in my lips too. It may not work, and they look weird at the end of the day. And I think making game plans, and I know you're big on that one, like saying, okay, this is today, and next time we can do that. So I think it's a matter of we actually have a really good question here. What do you like in tear trough areas? Because everybody wants to know what to put under the eyes. I think that's
definitely. So I know that a lot of people use Restylane as a gold standard because Restylane has been proven to be very safe. The only problem that I have with the Nacha technology, which is the Restylane family, is that they're particulate. You make a gel, and then you push it to different screen sizes. So the big screen give you what used to call perlingo Restylane lift, and then the middle size is your gold standard Restylane, and the smaller holes on the screen is Restylane silk. They're all particulate. The problem with that I've seen is that eventually over time, because the product is particulate, it's not very cohesive, doesn't want to stick together. Eventually, you will see people with a bump right here, right in front of the infraorbital. We know that people do not inject there. They inject right above, but it takes having good tequila parties. It takes getting anything that will create inflammation, like lasers. It can take microneedle in that area. It can take a really good cry to eventually get one little particle to flow away and get lodged between the zygomatic cutaneous ligament and the orbicular retained ligament. And nothing happens for a while, but over time, you will see somebody having a bump there that you have to melt. That's why for the teardrop, I like things that want to be stick together, a more cohesive product, which could be Velotero Balance or Volbella for some people.
Okay. And I definitely, I tend to go for Restylane Refine on that one, diluted a little bit. And it's the same. It's kind of a little more expression, it has the expression technology to it.
And it works quite well because the expression technology is very cohesive. That's why it's stretchable. Right. So the thing is that some people don't like to customize their own products. I have to sometimes. So yes, I put Restylane Refine or Define there, diluted, but because I know that I can reduce the viscosity, but I can keep the cohesivity of the product.
Exactly. So that was a good question. Thank you out there, whoever asked that one. Any other new products that you are using recently? You know what, real quick, because I think you and I are big PDO thread lifter.
Mm-hmm.
So, tell us a little bit about that, because everybody always wants to know about threads.
So I love threads. I think there's a learning curve. I cannot say that I'm the thread king, but I've been taking so many courses, and I keep bringing people because I want to be able to feel comfortable to teach really good techniques. But do I use them? Yes. And I think threads have their place. Because if somebody say, I want to just this, like this, I know that threads is the best way to do it. Also, if you have already maxed out the amount of filler that you can use for lifting, then you need to do threads. So, we cannot lift with volume only. We need to also pull. So it's better to learn threads for those people out there that don't know how to use them. You have to embrace them because you have to embrace everything that is coming out in order to help our patients to keep a natural look. Because if you want to be doing this for 10 more years and you only rely on fillers, eventually you are going to change the anatomy. You are going to make the patients look weird, even though that's not your goal. It's
Right.
just that 10 years of putting fillers on top of the bone, under the muscle, inside the muscle, on top of the muscle, and in the dermis will make a weird face
Yeah,
eventually.
it does, and we've all been guilty of that. I know I have. It's like I had to, you have to erase people. You have to know how to fix them too, which is part of our work. So, is there anything new coming out that maybe not even out yet that you can help us? Because I know you always get the inside scoop of what might be coming down the pike.
Well, in terms of fillers, which I don't know, I know that they're already in other countries like Colombia, Brazil, and Canada. There's new formulation of an HA with polylactic acid already mixed. Now, that sounds exciting, but I have my reservations
Yeah.
because if you have, whenever you do polylactic acid and you start to create collagen, I wonder because when you inject a filler that's a gel, you already have a shape. Most it's going to be round, and all depends how much you inject it or where you're injecting it. My question about those type of fillers is in terms if you are going to get an adverse reaction of a nodule, if it's going to be a nodule that's going to be really hard to melt,
Right.
and how do we deal with that. So for me, I never jump first. Whenever, even with threats, I waited 2 years.
Mm-hmm.
I don't want to experiment with my patients. I wait 2 years to see what happens out there, and then in terms of what I hear, if there's no a lot of bad reaction, something terrible, then I want to bring it into my practice and offer to my patient. I
Right.
just think that it's my responsibility never to make my patients a guinea pig. And I learned that the hard way with lasers. You
Uh-huh.
know, I purchased some lasers that weren't that great, and that created adverse reactions. So that quickly, I learned that I wait 2 years and see what happens,
Right.
you know, and then bring it into my practice.
No, I think it's you have to. I did try some of the polylactic acid spreads combined, and I wasn't impressed. I wasn't happy with some of the outcomes. It was like, and you have to do it on a close family member and people that are not going to be angry with you if there's something that you have to fix later. So, I think, making sure things work well prior to introducing them to our patient population in mass amounts is hugely responsible.
Yeah, no, I mean, first thing is that, again, we doctors first, and it's our responsibility to keep all of our patients safe. I think the problem is that a lot of times people want to be innovators on
Mm-hmm.
something, and that could be tricky because it can work amazing on your favor or it can ruin your reputation. So for me, it's like I don't want to be, of course, like my ego says, oh, let's be an innovator or something,
Mm-hmm.
but my
I think
spirit says no.
passion. I think
Calm
it's
down.
passion.
You are a doctor first, and you need to take care of your patient's safety first.
No, I totally agree. Well, we've spent a lot of time, and I don't want to take all your time. But one other question that I always ask everybody, definitely it's a different time because of this COVID-19. But on a regular basis, how do you stay happy and healthy every day?
What was that? I'm sorry.
How do you stay happy and healthy every day?
So for me, it's like, remember, and I mentioned before, we are healers and we share our light. We are, believe it or not, sometimes the light at the end of the tunnel of so many people that come to see us. Some of them getting older and looking at yourself in the mirror and see yourself change is a reminder on the subconscious mind that you're closer to your end. And sometimes, if you didn't do the things that you wanted to do when you were younger because you put it on hold, because you were a mommy, or because you were a wife dominated by a man that was strong-willed and didn't let you do the things that you wanted to do, sometimes that comes with regret. So if you help your patients look a little bit younger, they feel like, I still feel young enough and look good enough not to feel that I'm being judged for dressing a certain way or for wanting to learn something new. I think we do that to people. We give second chances. We give an opportunity to live your best life possible at any age and any decade. That said, you share a lot of your own light and you get depleted. So you have to do things at home that help you generate new light to be able to share it and to be able to take care of yourself. So when you're okay, you're able to be the best version of yourself to help those patients, right? Because they come for your light. They're doing that. So I meditate, I exercise, I eat healthy, I do take care of myself, and I try to teach by example, you know. So whenever my patients get in my room, we have tons of conversations about intermittent fasting and why to do it. We talk about why using paleo type of diet or low sugar diet so they can take care of the inside. Because what you and I do is a good paint job. But if you're not young in here, so I give my patient a spiritual facelift, and I know you do the same. But in order to do that, you have to take care of yourself first. Otherwise, you're gonna burn and crash. And when you burn and crash, you're not good to anyone.
You know what? I kind of feel like I just went through a therapy session, and I love it. Actually, you're inspirational. You really are. I'm very proud to know you and to call you not just a friend, but a fantastic colleague of mine. And have a healthy, blessed day, and be good to yourself. I know you are. And I'm going to let you go because I'm just going to go through some promotions that we're doing in the office. But thank you so much for joining us.
Thank you for having me. I love you. Everybody out there that wants to, please be safe. Stay at home. Don't take risks. This will pass. But remember, this is a time to reset everything. The planet needs to be reset, our economy, and each one of us needs to be reset. So please, everybody say we want things to go back to normal. No, we do not want things to go back to normal because our normal wasn't good enough. So we want all of us to go back to better than normal. And in order to do that, we need to start with ourselves. Okay? Thank you so much for having me.
Bye-bye, baby.
Love you. Ciao.
Love you. Bye. Well, okay, guys. I just feel like I went through a fantastic therapy session. Shino is a wonderful doctor, and he's just a beautiful human being. So I'm so glad he got to join us. And things that are going on in the office, we still have gift cards. They are actually doing extremely well. People, if you don't know, you can buy a gift card for $200 on our online store, and it's the value of $300 when you come and see us for our services with me and Christina. We also have a $500 gift card that you get a free cool tone. That's our muscle stimulation, which we all are going to need huge stimulation after this is over. And we get back and we get to get our engine going again. It will give you that booster that you need. We do have Skin Medica still 30% off. Our products are 10% off in the office. We are going to, actually, you should tune into Christina Live. Tomorrow, Christina's Coffee Chats. She's going to be having Lisa Pompelli, who is owner of Ivy Lee's. Who is one of our businesses that we utilize a lot, who do fantastic makeup, hair. She has a full service salon. We are going to have New Beauty and Real Self joining us in the next couple sessions. And they are foundations in our industry that give information to you, the followers, the clients, and help you guys get more information to make better choices. That's what this is all about, helping you make better choices on how you're going to look, feel at the end of the day with all this, because that's what this is all about. So everybody have a really healthy day. And as Shino said, get yourself in good order. This is our resting time to be able to come back in a better point. So ciao.